Hi, my name is Janice Carter. Part of our group project, I am presenting the article, Attention Deficit Hyperactivity Disorder by Nora D. Vocal, MD, and James M. Swanson, PhD, the teacher with ADHD. The article focused on a school teacher who was contemplating resigning from her job because she was having a hard time keeping up with her workload. Um, the teacher advised the therapist that she's had these kind of problems and symptoms since a child, but she was always able to do well in school. She shared with the therapist that her friends tells her that how much she talks and how disorganized she can be and impatient and careless and excessive. And fortunately for this teacher, she has now came to seek medical help for her symptoms because she was really feeling overwhelmed. Adults with ADHD, it does develop during childhood. It can also develop if a mother smoked, um, if she's obese and have diabetes during pregnancy. Also, children can develop this disorder if they're exposed to lead um, by through lead poisoning, and it's also a neurobiological disorder. The symptoms of ADHD must persist of 6 months or more. The diagnosis for adults requires the symptoms to manifest in two domains with a minimum of 5 out of 9 as far as the DSM 5 criteria is concerned. The eight persons with ADHD have inattention, their hyperactivity, and their impulse. Other manifestation of adults with ADHD is best to obtain your information from family and friends, and if it does affect their employment, domestic life, and social activities. The questions that I would ask the teacher if she was to come to see me for inattention, I would ask, do you wander off task, stay focused, and do you keep things organized? I would ask her for hyperactivity. Do you talk excessively? Do you sleep well? Do you have too much energy? Questions that I would ask the teacher about her impulsivity. Do you make hasty decisions? Do you socially intrude yourself in personal matters of others? Do you need immediate gratification without considering the long term effect? Other considers when diagnosing an adult for ADHD. The Mayo Clinic has suggested that conducting an assessment on an adult for ADHD can be tricky and requires additional testing for verification, such as conducting a physical examination to rule out any other medical condition. This is also part of the DSM criteria as well. Collect relevant documents and retrieve information from family and friends, as we already discussed. And you have to vet the symptoms under careful examination, ensuring that there's no other reason why the behavior manifestations are occurring. The assessment must also consider other mental health disorders, medical problems, or substance abuse that affect behavior, meaning that a person, especially an adult, when they come to self report, you must really vet the symptoms because unfortunately there are some people that are very good and they come to therapists for not the right reasons, which is sometimes to get psychotropic medication as a way of abusing in the way of substance abuse. Um, the article asked a question in the beginning, um, on how to advise the teacher who came to help for symptoms of ADHD because she was not functioning well and contemplating quitting her career as a teacher. And if I was in practice, I would first have her examined by what we just spoke of, the Mayo 3, which are the physical examination and gathering as much information as we possibly could. The DSM also emphasizes that as well. because it has to show a history. It cannot just be a one-time offense or one time just having a bad day. It has to be a history of these behavior manifestations, and also rated against other psychological mental disorders that this person could um, also be suffering with. And after a couple sessions, and then the patient and I, the teacher, as we're speaking of right now, will work out a plan specify just for her. The article notes that we just spoke about this. The teacher self-reporting her symptoms, even though it appeared to be truth, and caution always need to be demonstrated, especially as an adult. If not properly treated with medication, it could pose crucial harm to the teacher and possibly her students, which meaning she could have, a very bad reaction to the medication or some other kind of psychosis that could occur taking the medication while she has students in her care. The article further notes that after careful scrutiny, the teacher will receive the medication she needs to live a full and productive life. There are other things that a teacher could do to help is training and time management, prioritizing, help getting being organized, problem solving, motivation, and emotional regulation, along with therapy and medication. And in conclusion, our article also draws out the conclusion that the teacher did well in school, and because of that, her symptoms were not further examined. This teacher, who was considering ending her career due to perceived inabilities, now has hope for a brighter future. And that is one of the things that therapists and even parents and teachers and all who work with children need to really consider, even though she did well in school, she was really suffering. So I really applaud her for working very hard as a child and realizing as an adult that things just don't have to be as difficult. So thank you for listening to my presentation.